I'm Keaton Fletcher, an assistant professor of industrial organizational psychology at Colorado State University.
And I'm Mariana Arvon, an organizational psychologist who specializes in organization and talent development.
And this is Healthy Work. Hey there, listener. This is Editing Keaton, and we have a special episode of Healthy Work for you. This was recorded live at the Work Stress and Health Conference in Seattle in July 2025. This is an interview with the 2024-2025 Occupational Health Science Journal Best Paper Award winners. So forgive the background noise and the low recording quality, but I think it's something that you'll enjoy. And stick around after the credits for the winner's acceptance speech. I'm here at the Work Stress and Health Conference with the Best Paper Award winners from Occupational Health Science, and I'll get out of the way and let you introduce yourselves.
Hi, Leslie Hammer from Oregon Health and Science University and Director of the Oregon Healthy Workforce Center.
Cynthia Mohr, Professor of Social Psychology at Portland State University.
And Shalene Allen, Assistant Professor at Kansas State University.
Awesome, and so you guys just won, literally just won Best Paper, so congratulations on that. 2024-2025 Occupational Health Science. Can you give me a brief overview of your paper?
Yes, but I first want to mention that we also had our second author who is not here, Jennifer Dimoff from University of Ottawa Telfer School of Management.
So what is this paper?
This paper is the result of collaborative work that actually has gone on for quite some time. Cynthia and I have worked together for many, many years. Jen Dimoff has joined our team about 9 years ago, and Shalene Allen was a student during this process. And what the paper is about, it's about our conceptualization of how to think about training managers and supervisors on how to support psychological health and well-being of their employees. And it combines some of my prior work on supervisor supportive behaviors, which are sort of kind of preventative, proactive, supportive behaviors, with Jen Dimoff's work on really responsive behaviors, and they are behaviors focused on training managers and supervisors on how to recognize and respond to mental health challenges. And so we basically combine those constructs, and we have 6 constructs that are part of this framework for protecting and promoting employee mental health.
Awesome. So it sounds like the point of this paper is really capturing supervisors. It's like the frontline intervention with workers of how do we get them to make a safer, healthier work environment beforehand, and then when things happen, how do we help them address issues once they arise. And so you mentioned there's 6 issues or 6 topics that the supervisors or managers are involved in. What are some of those?
There's 6 dimensions, and what we're suggesting is this framework has 6 dimensions, and we're actually developing and validating a measure based on those 6 dimensions. And those 6 dimensions are emotional support, practical support, role modeling, reducing stigma, warning sign recognition, and warning sign response. And those dimensions, again, are based on the prior work that my team has done on supervisor supportive behaviors, and it really originated back in the work that I did with Ellen Kosick, and then the work that Jen and her colleagues, Kevin Kellaway, have done on really managers' responses and kind of knowledge and literacy around mental health and how to respond to mental health challenges.
I mean, so it sounds like there's so much in this paper that's meaningful, practical advice for supervisors and that you cover. And I wonder, I have 3 of you here. Do you each have one thing that, if you only got one takeaway for a manager, what's your do this?
I would say the conversation starters that we stated in the paper of, okay, how do you even start a conversation with an employee who might be struggling? Take the time out of your day, sit down with them, ask them first how they're doing, and then develop a plan and a strategy when they are suffering. I think that was the key point for me, that those conversation starters in the paper.
I would say it's the role modeling. So thinking about how you talk with people you work with about issues that you face and how you dealt with them, so that you're kind of destigmatizing, but you're also showing people I have these experiences too. I was able to overcome it, and it sort of opens up that ability to connect and makes workers feel like they can maybe talk to you about issues.
And I think all of these are really actually very important. They're all strategies for managers and supervisors to implement. And I think that the other piece that I feel is really important, but developing this kind of emotional supportive connection with employees and teaching them and basically responding to them so that they feel a sense of psychological safety and that they feel that you actually, as a supervisor or manager, that you actually care about who they are and what's going on in their lives, so that if they have a concern, they can actually come back and ask for some support. So you have to, for managers and supervisors, they have to actually know their employees and individual employees to be able to provide support.
And that's, I think, a key point is like knowing your employees so you can tell when something's off.
Yes, and normalizing that it's
Yeah.
okay
Yeah.
to talk about that at
Right.
work.
Right.
I love that. And as researchers, was there anything that surprised you or really challenged you about writing this paper?
This paper went through many different forms, and it was interesting. And I mentioned this earlier, but it really took a lot of feedback from the editors of this special issue, because this is part of the special issue on chronic health conditions that was edited by a number of people, but Alyssa McGonigal and Casey Chosewood and others. And we received some really wonderful feedback to help guide this paper so that it would be most impactful. And I would say that, Alyssa and Bob Sinclair and Tapas had provided just some amazing feedback that really led to this very important paper. We're extremely proud of this paper, and we are able to make it available to not just researchers, but to managers and supervisors to really point to and say, these are some of the strategies. Because we do have training that we've developed now, and that is evaluated in randomized controlled trial, and it's effective based on these strategies. But not all managers are going to implement the training. And so this is actually something that we can hand to managers so that they can actually implement some of the strategies on their own without having to go through the training.
That's awesome. And so my last question for you, my favorite question is, why do you do this work broadly?
I've been doing this work broadly for probably 34 years because I am passionate about improving health and well-being of workers and their family members. And I, in particular, more recently am just extremely motivated to get so much of this out in the hands of organizational practitioners. And so much of the work that I've done in the past 15 years has been very practical, very applied research so that I can have an impact in organizations to improve health and well-being of workers.
I would say as a social relationships researcher, I know how important it is to have good social connections. And I know that in order to, have a healthy, thriving society, we need to have good relationships in all domains. So, family, school, work, community. And so this is a part of building that social connection, those, relationships that we can draw on and that will boost our well-being.
Yeah, a lot of my motivation for entering this space in IO psychology and occupational health in particular is my family. They largely never had a space or voice with their concerns. That we come from a logging family background, and so that motivates me to lift up the voices and to help those who have largely not been helped. So I think this is really great.
I want to just say one more thing, because Jen Dimoff, who is the second author on this paper, was really instrumental in, everybody was instrumental, all of the authors, and as I said, the reviewers. But Jen and I have been working together, as I said, over the past 10 years on pulling together the very important work that she has done in the area of mental health awareness training for managers, and kind of combining that with the Supervisor Supportive Behavior training. And we had the opportunity to pull this together through a grant opportunity that the DoD, Department of Defense, funded, where we developed this training, this specific training using these dimensions for service members, so that the actual leaders in the active duty military could be trained on how to support psychological health and well-being of their service members. And it integrated my work on supportive behaviors with Jen's, and I think that the conceptualization of this really came from our team. So
That's awesome. Well, thank you all so much for your time and for your great work, and congratulations again. Enjoy the rest of the conference.
Thank you.
Healthy Work is a podcast written and executive produced by Keaton Fletcher and Mariana Arvon. This episode is produced, mixed, and edited by Keaton Fletcher. Artwork is by Keaton Fletcher, and our music is Zero, Microsong by Steve Combs. Please like us, follow us, and subscribe on whatever podcatching software you use, and please leave a review on the iTunes store. It really does help get us out there.
it's the framework that we've been using for really developing and implementing our training around workplace mental health. And this paper did not just come easy from us. This paper is part of this special issue. And we had, I don't know if Alyssa's here, we had amazing feedback from Tapas and Alyssa and Bob. And then I know we had anonymous reviewers, but that steered us in the direction to get to this paper. I mean, this was not just a submission and we got feedback from the from the reviewers and then we revised it and it got accepted. This had a lot of kind of tweaks and turns and a lot of hand-holding from the editorial board. So I really appreciate the guidance here. And it led to what we have and our team. I mean, it's Cynthia and Shay and Jen. I mean, it's just really. I mean, this was a big undertaking, and it had a lot of input from a lot of people. So, yes.